We're here today with somebody who is going through a very difficult time, a emergency room physician, Ron Elfenbein. And I honestly had not heard your story until Kirk Moore actually reached out to me. And it is just horrific what you're going through. There is a lot to your story. I'm just going to let you start and kind of give us I'll give everybody an overview. Basically, the government is going after him and trying to put him in jail over, they're arguing over coding for uh, visits that went on during COVID. But tell us, Ron, sort of what happened.
Well, thanks for having me, man. I appreciate you inviting me on. I really thank you so much. Yeah, so basically, I'm the victim of lawfare, plain and simple. Just imagine, if you can, waking up one day, you're a law-abiding citizen, you're a physician, you work hard, you try to do the right thing, and you get indicted on federal healthcare charges completely out of the blue. You just wake up one day and your entire life is turned upside down. That's the nightmare that I've been living for the last 3+ years. It's just been a horror show. Um, Before I get into everything, I just want to say, like, sometimes talking about this, I feel like I'm wearing a tin hat, like I'm a crazy person, but it's not crazy. This is my life, this is reality, and this is exactly what goes on. And the more people I talk to, the more I realize how common stories like mine are. So just a real quick background on me. I'm an emergency physician, like you said, Mary. I kind of saw I started an urgent care center in 2016 because I wanted to own my own facility and I wanted to be the medical director. And I just wanted to be, I'm an entrepreneur at heart. So I wanted to do some entrepreneurial things. Um, I saw what was coming with COVID. I realized that this was not going to be contained in China. I mean, when you looked at what was going on, they were boarding people up inside of, there were entire cities basically. So clearly it was going to come to the United States at some point, and I realized that. And I started stockpiling PPE and whatever testing supplies I could because I knew what was eventually going to hit us. Um, I also, in 2010, I'm a Republican. I ran for state senate. I say this because it'll have some relevance later. But I ran for state senate, nearly beating a 30-year Democrat incumbent, and it was very, very close. But anyway, so I saw what was coming, and I stockpiled the PPE. COVID hit, and we immediately started to become a very, very active testing center. We became probably the busiest testing center, certainly in the county, possibly in the state. And we very quickly went from one site to 8 sites. And, we employed over 300 people at the height of the pandemic. Um, I had friends of mine throughout the country who were physicians who were forced to work, with literally with garbage bags as PPE. So I took some of my PPE at my expense and I started donating it to people around the country, people that I knew, people that I didn't know, nursing homes, doctors, ICUs. I developed an intubation box, which is basically like a Lexan box that you can put over. Well, I didn't develop it. I helped market it and develop it, and somebody else, an engineer, built it. But we set up a GoFundMe, and we distributed these things throughout the country free of charge to anyone who wanted one. The idea is that you can contain the virus when you're intubating somebody. Um, I volunteered to pick up extra shifts in the emergency departments because they were, nobody wanted to work. I took my urgent care staff and we went into the nursing homes when the state and the feds and the counties wouldn't do it, and they were mandating that all these people get tested, but they weren't providing any tests. I personally went into these facilities myself in PPE, risked my own life, went in and tested these people who unfortunately were dying in droves because it was just such a horrible thing and it happened so quickly. Um, I wrote an ebook on COVID, which I gave away for free during the pandemic to try to just allay some fears. I uh, I was on the news pretty much weekly. I was on Breitbart, I was on Fox, I was on CBS, I was on Sky News, I was on Newsmax talking about the pandemic, and then eventually the monoclonal antibodies. And I became a very big proponent of monoclonal antibodies. I was an early adopter, so much so that my facilities, we were the only, as far as I know, the only private facility that started to use monoclonal antibodies on an outpatient basis and provide infusions. And I was very outspoken about how wonderful these things were, which was in direct opposition to the administration's everybody needs a vaccine because this basically was a cure for COVID. So you really didn't need to be vaccinated if you could get cured. And I mean, the efficacy of the monoclonals was ridiculous. It still is. It's amazing. The product is truly life saving and incredible. Um, we became the largest supplier of monoclonal antibodies in the state of Maryland. We were larger than Johns Hopkins. We were larger than the University of Maryland. So the state would allocate to us the lion's share of monoclonal antibodies, and we would infuse people. And then in December of 2021, the Biden administration came out and said, we're going to stop the program because the Omicron variant, once it reached 70% prevalence, the monoclonals that we have no longer work. And I went on Fox News and I said, this is a terrible idea. You're going to kill people. You're misreading the data. You're relying on faulty data. You're relying on faulty models, and you're wrong. And it was a big headline on Fox News. And 2 weeks later, it turns out I was right. And the Biden administration admitted that they made a mistake. And they turned around and said, we were off by a factor of 50%. The prevalence wasn't 70%, it was 20%. So we're sorry. But in the meantime, we had to cancel probably 500 people who we had scheduled to get infused, that I'm sure a certain percentage of those people are no longer with us because of that. So I was pretty angry. And when I went on the news, I let them have it. Well, 4 weeks later, or 4 months later, I find myself the victim of a federal indictment on healthcare fraud charges. Out of the blue, no warning, no letter, no phone call, no email, nothing. Just, hey, you've been indicted on healthcare charges. And by the way, for my work during COVID, and I don't say this to pat myself on the back, I'm saying this so that you have an understanding of like what the background was. But I got the governor of Maryland personally gave me a citation for the work that I did during COVID. The state legislature gave me a citation for all the work that I did during COVID. And the state medical society, even after the indictment, named me its person of the year for all the work that I did during COVID. And yet I still got indicted on federal healthcare fraud charges. And what's interesting to me, and it should really scare everybody on this pod that's listening, is that the government indicted me for basically upcoding without looking at the charts. Now, as you know, as a physician, in order to what you're billing is based off of what's in your chart. So how can you say that somebody's upcoding if you haven't looked at what's in the chart? And I know they didn't look at the charts because I hadn't turned them over before I got indicted, and the only one with access to the charts was me. So, it was horrific. It was horrible. I mean, my life was completely turned upside down. And by the way, they got my name wrong on every piece of document every document that they've sent. They gave me a middle name, which I do not have. I've never had a middle name. Just to show you what kind of a crappy job they did in terms of their background investigation, they gave me a middle initial and a middle name, which I don't have. I've never had. So I don't know where that came from, but they gave me one. So for months you get this indictment, and it just basically reads, we're charging you with this crime and blah blah blah, but it doesn't specify what they're coming after you for. So for months you're sitting there, oh my God, what are they charging me with? I mean, I couldn't sleep, I couldn't eat. I've never been suicidal in my life, but I think this was the closest I've ever been to being suicidal. I have 4 children and I have a wife who's also a physician, and I can't imagine. I can't put into words what it's like to go through something like this. Other than losing a family member, I think this whole experience is just below that. That's how I would rank it in terms of like the awfulness scale, if that's a good word to describe it. So I said we have 4 children. My wife's a pediatric oncologist. She runs the bone marrow transplant program at Johns Hopkins, and we have 4 kids. At this point, the youngest was 3, and the oldest was 15, I believe, or 14. They all had to go into therapy. None of them, they were all very well-adjusted children. They're all, straight A students, but they all had 3 of the 4. The youngest was spared because he didn't understand what was going on, but the 3 of the 4 had to go into therapy. My 12-year-old daughter, for a year, would not sleep anywhere but in my bed with me. And I couldn't, sorry, it's very emotional. I couldn't sleep, so I just lie there. She'd be lying next to me and like sleeping, but I would just be staring at the ceiling and thinking about spending the rest of my life in jail. And I faced 50 years in jail, by the way, and millions of dollars in restitution for something I did not do. I got debanked, so my father was a member of the Air Force, USAA. I've been a member of USAA since I was born. Basically sent me a letter saying, take your money and go. We're not interested in having you decline anymore. Truist Bank dropped me. American Express had been a customer for 25 years. They said, you're no longer a customer of ours. My TSA pre-check was revoked. I owned a rifle. I've never shot it, but I own a rifle. I had to give that up.
Wow.
I lost my ability to go into my kids' schools to chaperone. if you can believe that. I've been very active in all my children's, I was on the PTA, and I've done going in, I talk about being a doctor, how wonderful it is, and blah, blah, blah. And no, couldn't do that anymore because now I've been convicted, I've been charged with a crime. So they wouldn't let me go into the schools anymore.
Wow.
Um, and I always said, like, I didn't do anything wrong. How is this possible? And there's an old saying in apparently in the legal profession that a grand jury will indict a ham sandwich. And it's true. I mean, I'm living proof of that they had no evidence whatsoever, but yet they still came after me and they still indicted me. And all during this, not to like, play the violin here, but while this was all going on, my father was slowly passing away. He was dying of chronic illness, and I had to move my parents into an assisted living center in New Jersey. So I had to deal with that as well. And of all the things that this has done to me and all the horrors that had been inflicted by all this, the one thing I cannot forgive is that I've never been able to grieve for my father.
Hmm.
Because the whole time this was going on, he's passing away in front of my eyes. And I'm thinking, geez, I'm not going to see my kids graduate. Sorry.
Hmm.
I'm not going to watch my children get married. First day of kindergarten, first day of nursery school for Zach, my youngest. I'm not going to get to witness that. I've always been a very active father and part of their lives. And this is what you're thinking the whole time. Like, I'm going to be absent from their lives and I'm going to die in prison. Um, so it's a horror show. So anyway, I went to trial because I didn't do anything wrong. And I'm sorry I'm getting so emotional, but this is it's cathartic for me to talk about, but it's very obviously difficult. Um, I went to trial because I didn't do anything wrong. And my lawyer told me, look, you have a great case. We're going to win this. Um, there's two types of people go to trial, innocent people and crazy people, and you're not crazy, so you should take it to trial. And, there's a trial penalty. If you go to trial and you're found guilty, they penalize you for that. They add more time to your conviction, which is ridiculous. That doesn't make any sense. Why should you be convicted, or why should you be punished for utilizing something that's guaranteed to you in the Constitution? And the whole system is completely rigged. It's designed to get you to plead or to go to jail. Those are the two options, and that's really all there are, which is why they have like a 98% success rate. Either most people plead or they go to jail. And a lot of those people, I will tell you, did not do anything wrong. I know that for a fact after having gone through this. Um, so, the government had multiple theories at the trial. The first theory, and one of the ones that was mentioned in the indictment, is that we didn't spend enough time with the patients, that the visits were all quick and easy, and that we were building level 4 visits for the E&M coding. And they said, well, you shouldn't be billing a level 4 because you only spent, a few minutes with the patient. And I admitted that. Of course, we only spent a few minutes with the patients. And by the way, I didn't see any of these patients. I was the medical director, but I wasn't actually on the ground seeing the patients. I was running around making sure things were functioning and making sure that the protocols were in place and all that, and everybody was safe. I was not seeing the patients myself. So that was their first theory. And their own expert witness testified, quote, time was not a factor used to select the coding level. And that is in direct opposition to what they indicted me on. In the indictment, it says, you did not, essentially, I'm paraphrasing, but you did not spend enough time with your patients. And yet their own expert testified that time was not a factor used to determine coding levels. Then they said, well, these were medically unnecessary. Right? You did not need to. We had providers see every patient. So there was a nurse practitioner or PA see every single patient. And they said, well, that's not medically necessary. Their own witness, once again, said that CMS, so Centers for Medicare and Medicaid Studies, and the CDC wanted to have a provider see every patient and have an evaluation and management visit the same day as the test. Their own witness, once again, in direct opposition to what their indictment said. Then they said, well, you're upcoding. Basically, you're charging too much. You're billing too high a level. And no one ever asked me. All they had to do is pick up the phone and say, well, why did you pick a level 4 visit? Why did you do level 4? Why did you pick a level 3? Why didn't you pick level 2? I had a rationale for it, but they didn't seem to care. Nobody ever asked. And it was interesting is that they came after me for this upcoding thing, but I don't know if you know this, Mary, but undercoding is almost as bad as upcoding. They can come after you for that too. If you're purposefully undercoding, they can throw you in jail. They can take your license. They can fine you. They can come after you with the False Claims Act. So there's all sorts of penalties for undercoding. So it's like saying, the speed limit's 50. If you go over 50, we're going to give you a ticket. If you go under 50, you give you a ticket. And if you go 50, we're going to give you a ticket. So what the hell are you supposed to do? And finally, their last theory was common sense. And they said, well, and this was because basically everything else wasn't working. So at the end, they said, all of our other theories have basically been debunked. So at closing, they talked about this common sense theory. They also talked about inaccurate charts, and they came after me because they said, "Oh, your charting was inaccurate." Again, I didn't see these patients, but I did create templates, and I'm sure that you know that everybody uses templates with electronic health records. That's nothing new, but they made it somehow nefarious that we were using templates, and they put up to the jury, "Look, all these charts look very similar. He's a fraudster. He's committing fraud because all these charts look very similar." And one of the counts, so there were 5 counts. One of the counts was the provider picked the wrong template, and she admitted that under oath on the stand. She said, "Yeah, I picked the wrong template. I used a template. I was seeing the patient virtually, and I picked a live template. I shouldn't have done it, but I did, and there were things checked that I didn't do. But I didn't tell her to do that. That's not on me. She picked the wrong template. But somehow it's my fault, and I'm held criminally liable for that." Um, so the first day, I'm sorry this is going on so long, but I'm trying to just give you some background here. So the first day, they bring out their quote unquote expert witness, and my lawyer just completely obliterated him on the stand. He knew nothing, to the point where the judge excused the jury, said, "Go to the jury room. I need to talk to the attorneys." And he called us up to the bench, and he looked at the government and said, "What the hell are you doing?" And that's a direct quote. "Where is the crime here?" And, "Oh, you'll see, Judge, there's more to come. There's more to come, blah, blah, blah." And he said, "Well, you better show me something quick because I'm about to throw this entire case out. Your expert witness about whom this entire case is based on just got destroyed on the witness stand and knows nothing about anything." And this is coming from the judge. Um, so then they bring the jury back in, they bring that witness that got utterly impeached. And then this guy, believe it or not, starts getting up on the stand and talking about um, this billing manual that he has in his hand and how what we were doing was wrong. And my lawyer on cross-examination said, that billing manual, this trial is about federal CMS, like Medicare and private insurance companies. What you're holding in your hand and you've been quoting from is a Maryland state Medicaid billing book that has no bearing and no relevance to anything in this trial." And the guy looked like a complete fool because that's what he was holding in his hand and that's what he was quoting from. And he was totally wrong. And he knew nothing about the changes in the coding for COVID, nothing about anything regarding COVID. It was a nightmare, and this guy was completely torn apart. We saw over 100,000 patients during this entire time that the indictment ranges from. They picked 5. They looked at 5 charts, and they didn't even have a coder look at the 5 charts, just the government attorneys. The government lawyers looked at the charts. They didn't have a professional coder look at them, just the government lawyers. We had a professional coder. And of course, I had to pay the guy a fortune to do this, but he went through hundreds of charts. And his conclusion, in which he testified to at trial, was not only was the coding 100% spot on, but a couple of charts were undercoded. And again, the government alleges that we stole $15 million or in excess of $15 million. They looked at 5 charts.
What is the price difference in terms of reimbursement between a level 3 and a level 4?
Yeah, that's a good question. So it varies depending on the insurance company, but it's about $50, $60. It's not a lot of money. And that's, by the way, for your listeners, because you and I know this, but a lot of people don't. People look at doctor bills that they get in the mail and they'll say, "Oh my God, why are they billing me so much money?" That's not what you get paid, right? So you bill a certain amount, but the insurance company pays what they pay you. It doesn't matter what you bill. You could bill $1 billion. You're going to get paid what they're going to pay you, and everybody gets paid that. That's it. So, but the insurance companies are smart because they say, "We're going to pay you the less of either what we pay, which is usual and customary, or what you bill." So, and they don't tell you what the usual and customary is. So you have to bill high because otherwise they're going to screw you. So everybody bills high, but you never get paid that. But that's what they're going off of. The government is. They're saying, "Oh, you billed, a $350 visit when we may have gotten paid $200 for it, maybe."
Right.
So, then that's the other thing is they said, "Oh, well, you billed all your level 4. All these patients were billed a level 4." But as you know, like everybody got the same workup. So of course they're all billed the same way because everybody had exactly the same thing done. They had the same testing done. They had the same office visit done. So the billing, of course, should be the same because otherwise it would be fraudulent.
Well, and those coding, it's very ambiguous. It's not as straight. It always bothered
Yes.
me, and I don't take Medicare, thankfully, so I don't have to deal with it. I don't take insurance, but it's always very ambiguous. I mean, with every patient, you're wondering, I'm not sure which way to go here. So you put it's always a guess. It's always a guess.
Yes.
And
Absolutely.
and then they relaxed the rules during COVID for coding, from what I understand, right?
Yes, they did. And the government was not even aware of their own rules. So they came after me again. I've already listed 3 or 4 instances of where they indictment is directly opposed by what their own expert testified to. So they didn't even understand their own rules when they charged me with the crime, which is just mind-boggling. But that's how this again, I told you, I feel like I'm wearing a tin hat and I'm like a psychopath, but this is real. And
It
you
is.
know,
I mean, it's
so
truly insane that they are trying to throw you in jail for 50 years over upcoding during a pandemic where the rules relaxed. Where, I mean, I saw the chart and we'll show that chart. You did exactly what was warranted under that chart. I mean,
yes, and not only that. So if you go through the chart, so if I have one right here, so I can, it's basically if you go, basically you got to go through the columns and you pick what's the most likely thing for the column.
yeah.
So if you go through column one, it says number and complexity of problems addressed. Well, if you go down to moderate, which is 99204, 99214, it says undiagnosed new problem, excuse me, with uncertain prognosis. Now the government was telling us for the diagnosis code to use exposure to COVID for everybody. Normally, as you know, they're rule out codes, rule out this, rule out that. No, they specifically said do not use the rule out code, use the exposure code, which implies everybody is exposed, which is why anyone who came to get tested was told isolate yourself because we
Mhm.
thought everybody was exposed. The entire world was shut down, if you remember, right? So this clearly was taken very seriously. Well, the only thing in any of these boxes that seems to remotely qualify for COVID is that one undiagnosed new problem with uncertain prognosis. It's an undiagnosed new problem when you come to me, and the prognosis you could die or you could be fine. I don't know, and there's
Right.
no way for me to know. That seems pretty straightforward to me. Then you go to column two, medical decision making, and if you go to the moderate box, the third one from the top, it says basically any combination of tests and documents. We did every single patient again. Every single patient who came in got a PCR test, which was resulted the next day, and a rapid test, which was resulted that day. You get 2 points for that. And if you add all this up, that gives you a 99204 or a 99214, which is moderate complexity.
Right.
It's not rocket science. It's right here on this chart.
Right. Right.
And that's how I came to the conclusion that this was the right way to bill. Because again, I didn't want to underbill because I would get in trouble if I underbilled. So I went through the chart and I said, well, this one makes the most sense. I even went on the Novitas, the CMS, or sorry, the American, I'm going to get the acronym wrong, but it's the Professional Coders Association. They have a
Mhm.
website and they have a calculator on the website. I must have done it 50 times. I went through it and I calculated, and every single time it came up as a 99204 or a 99214. I'm like, okay, that's why I chose to build a level 4. But again, no one in the government ever thought to ask, what was your rationale for this? Why did you pick that? And they said, well, during trial, they said, look at his tax returns. They showed my tax returns. And they said, look, before COVID, he made this. And by the way, I didn't even make that much money during COVID. I mean, we did well, but it wasn't like I was, $15 million.
Right.
And they said, look how much money he made. He must be a criminal. And I thought to myself, like, what was going on during that time? We were seeing, hundreds of people a day. Of course, my income went up. Like I'm not going to hide that. Of course that's true. And in order to prove that I had the criminal intent, they used my emails against me, and I sent a bunch of emails to all our providers explaining what E&M coding is, evaluation and management. And I said, this is the bread and butter of how we get paid, which is God's honest truth. That's how we get paid. That is
Right.
our bread and butter. And they said, look, bread and butter, bread and butter. He keeps saying it. He's a criminal. He's greedy. He just wants to get paid more.
Wow.
Literally, I'm not making this up. That's they again and again and again. Bread and butter, bread and butter, bread and butter. Look how much money he made. Like it was just mind-boggling and crazy. Um, so at closing, I mentioned that they talked about common sense. So I think the government's case was completely obliterated. Closing comes around. we actually had character witnesses to call. But my lawyers are like, listen, the government has presented no evidence you did anything wrong. We're going to win this case. We're not going to call your character witnesses because the more people you call, the more chances something could go wrong. So we don't want to call them. And that made sense to me. I said, okay. So closing comes around and the government gets up there and they say, you know, you may be asking yourself what the appropriate code is here. Is it a level 1, a level 2, a level 3, a level 4? It doesn't matter. You don't need to know. The only thing you need to know is that Dr. Elfenbein is wrong and he's a criminal. Now, that's wrong on so many levels, but to your point, Mary, it speaks to the ambiguity because they didn't even know. The government did not ever say what the right code should have been. They just said level 4 was incorrect. And they didn't say why. They just said level 4 was incorrect. Now, they said, look, the defense is going to try to confuse you. Use your common sense because none of this makes any sense. And you know what? They're right. It doesn't make sense. But the rules are the rules, and these are the rules right here. And I followed the rules. The government's not following the rules. And I didn't write the rules. I followed the rules. But none of this is common sense. And my response to them would have been like, have you ever filed a tax return? Like, there's no common sense in any of this stuff. The government wrote the rules. Like, of course, there's no common sense. But that's what they said to the jury. And I think it resonated with them. And I guess we didn't do a good enough job hitting back against that. And the jury found me guilty. And I'll tell you that drive home was perhaps the worst drive I've ever had in my life because my kids were all sitting in the driveway waiting. And they said they could see it on my face when we pulled in. I was just completely devastated. I mean, I was just, because the whole time I'm thinking I did nothing wrong. How could anybody think I'm guilty? Well, unfortunately they did, but luckily, it's about 2.5, 3 months later on December 21st, the chief judge of Maryland, Judge James Bradar, who sat through the entire trial, issued a 93-page opinion castigating the government's case and acquitting me of all charges, and in the alternate, giving me a new trial. And basically said, if the government appeals this and you lose on appeal, you're going to have a new trial because the judge felt that strongly that I did nothing wrong and there was no evidence that he did this for me. And I'm just going to read a couple of quotes that I wrote down because, again, like, don't just take my word for it. This is the chief judge who sat through the trial. He said the government's coding expert was, quote, unfamiliar with the coding guidance that had been issued during the course of the pandemic, end quote. Quote, the court expressed concern during trial regarding his testimony, explaining that his testimony appeared to undermine the underlying legal foundation for it all. Quote, the court, having closely observed the testimony and parsed the evidence in this case, concludes that the evidence weighs so heavily against the verdict that it would be unjust to enter judgment, end quote. Quote, there can be, of course, no crime if the defendant complied with those rules. Quote, not only is there insufficient evidence to prove that the defendant's reading was unreasonable, but there was evidence that affirmatively supports defendant's understanding of the coding requirements. There is simply not sufficient evidence that the defendant's reading of the CPT manual was not in compliance with the coding requirements such that a reasonable jury could find falsity beyond a reasonable doubt. It is not a criminal, quote, it is not a criminal offense to take advantage of loose definitions for an explicit loophole any more than it is to do so when citizens prepare their tax returns. Citizens, including healthcare providers, cannot be held to criminal account for doing only what a technical regulation is reasonably read to permit. Quote, common sense may well dictate that a provider who bills for a 5-minute encounter is cheating, but it is not a crime if the government has authorized him to do it. Quote, the government did not carry its burden and no reasonable jury could have so concluded, end quote. So that was the happiest day of my life. My lawyer texted me and he called me and my phone ringing and I was like, oh my God, what horror does he have to tell me now? Because it's never good news when he called me. And he says, can I get you on the phone in 5 minutes with the entire team? We want to talk to you. And I was like, oh God, they're going to tell me they added another crime to my, whatever, some horrible thing. And I'm like, sure. And now, of course, I got to wait 10 minutes. And, it's like you saying to somebody, hey, I got your biopsy results back, but would you mind if I go to the bathroom before I tell you, like it was the worst thing you could have possibly done. But I went to my office because I didn't want my family to see what was, was coming. And the whole team's on the line. And he says, we just got Judge Bradar's opinion and he acquitted you. Mm. And I fell to the ground and I was just screaming. And my wife comes right in. She's like, are you okay? And I'm like, I couldn't get the words out. And it was just the best day of my life. And it was like unbelievable. So for the first time in basically 3 years, I actually slept the entire night that night. I just felt like this huge weight had just completely vanished, and it was just the greatest feeling on earth. But I wanted to get back to work. I'm a physician. I wanted to get back to work, but I hadn't worked in 2 years. So getting back to work was really hard because most people, first of all, I didn't work in 2 years. So most places said, well, we can't insure you because you haven't worked in 2 years. And then they also said, well, you were charged with the crime, all the stuff. You look guilty, or it doesn't look good for you. And so a lot of places were very hesitant to hire me. I luckily got back to the emergency group that I was working for. And then I actually ironically found a job, which I love, with this company providing medical care for the prisons and jails in the state of Maryland. It's a great job, and it's absolutely wonderful. But the story doesn't end there. So the government, a couple of weeks before Trump was inaugurated, decided, the Biden administration, rather, I shouldn't say the government, decided to appeal this. And one of the judges on that panel, so they give you the Fourth Circuit, they give you these three judges they randomly assign supposedly to the panel. And one of those judges is the same judge that was overseeing the Comey investigation and called Trump's attorney, the prosecutor, a puppet. Um, they overturned the judge's decision in a really, for lack of a better way to say it, head scratching decision. It just doesn't make any sense, and nobody can make heads or tails of it. Um, and they just got a lot of things wrong. For example, one of the major things was they said, well, when you submit your claims to insurance companies, you submit all your paperwork with that, which is completely not true. When you submit a claim to an insurance company, you only submit your claim. You don't submit the chart unless they ask for it, which is when they do an audit. Other than that, they never ask for the charts. But they said multiple times in their opinion that we provided the charts, which had never been said at trial and was not part of anything. And as you know, as a practicing physician, we just don't do. Um, they claim that there was this false document theory that was never part of the trial or the indictment. Um, they basically claim that many times. Again, the government tried to claim it during the trial, but it was never part of the indictment, and it really never came to much. Then they said that using this false document theory that there was one patient who claimed that she was never seen at trial. The 5 counts. This one old lady said she was never seen, despite the fact that we have handwritten notes with all of her vital signs, and we have her, her own signature. But she said she was never seen by a provider. But the provider wrote an entire note, and the note reflects what she wrote about her past medical history. So clearly, either the provider was lying or she did see her. But regardless, I didn't see her, and I didn't instruct the provider to falsify documents. So, like, what bearing does that have? Who cares? And this is the same patient at trial who was called by the government, and she said that she called the number on her EOB, and we told her basically to go pound sand. Well, the number on the EOB is a fax number. And we said that at trial. My lawyer cross-examined her and said, you sure this is the number you called? Oh, yes, 100%. This is the only number you called. Yes, 100%. Well, what if we told you that number was a fax number and is only a fax number? It's a dedicated fax to the billing company in Maine. And she said, well, I don't know. I called that number, and that's what I was told. Um, so, the Fourth Circuit basically even said, as you said, that the coding is ambiguous. Both the circuit court judge and the Fourth Circuit, the appeals court, said that the coding is ambiguous. And the Fourth Circuit said that the evidence against me was incredibly thin. But basically, they overturned it, and they said that the government, there's two elements of a crime. There's falsity, meaning that there's an actual crime, and there's intent. And the government has to prove both of those elements independently. And the Fourth Circuit basically said the government no longer has to prove falsity. They just have to offer whatever they think is the best in an ambiguous situation. They think is better, and they can try you. So basically, that should frighten all physicians, and basically everybody on this who's a taxpayer too, because in anything ambiguous, the government can say, well, what you did was totally reasonable, and the Fourth Circuit acknowledged that what I did was reasonable, but the government's still free to come after you and try you criminally because they disagree with you, even though what you did was reasonable and makes sense. It's insane. How can anybody think that's okay? So no longer do they have to prove that you actually committed a crime, that what you did was actually that you took this coding thing, you tore it in half, and you said, you know what? It's not based on anything. I'm just going to bill a level 4 because I think it's the right thing to do, because I want to make a lot of money. Not because of any rationale or logic, just because I want to do it. They don't have to prove that anymore. Even though what you did makes perfect sense and you can be backed up by 100 coders, if the government thinks that their option is better, they can try you with the crime. Just like saying, Mary, you filed your tax return last year and what you did makes sense. And, we see what your accountant did. It's perfectly fine, but we disagree. So we're going to throw you in jail.
So what's the next step?
Yeah. So, well, I face a new trial now in August. Um, so the first trial cost me about $2 to $2.5 million, which I did not have, and I'm still paying my attorneys a little bit every single month. They've been very magnanimous, and they've been wonderful. And I pay my debts. I'm an honest person. Um, I will be paying them until I die, basically. But now I'm facing a new trial, which is probably going to cost $3 million, which I don't have. Um, Interestingly, Judge Bradar, the judge that wrote this opinion, was supposed to adjudicate this trial as well, which would have been good for me, I think. But as of about a month ago, he sent a one-line email saying he's recusing himself from the case. Now, I have no idea why he didn't specify, but the only reason I can think of is that he felt so strongly that this case is such a bunch of nonsense that he didn't feel like he could be objective to the government.
Mm-hmm.
Now, personally, I don't think he should have recused himself because, they're choosing to bring this case. That's on them. But he did. So now I face a new trial in August, um, which is just a whole nother level of nightmare going through this again. And now the government has a roadmap because the judge wrote a 93-page opinion on where all their problems lie. So now they know exactly what they need to do to fix it so they can convict me and throw me in jail. So I just don't see how I can win. So we're really trying to get somebody in the Trump administration to wake up and say, hey, this case makes no sense. It's unfair. It's ridiculous. And we shouldn't be prosecuting this person. I acted appropriately. I did the right thing during COVID. I stepped up. I tried to help my community. I tried to help my state. And this is the thanks I get for it.
Well, I am so sorry. I mean, you truly did go above and beyond. And the monoclonal antibodies, I saw the exact same thing. They worked really well. People would just spring back the next day. And I agree.
Yeah.
They took them away because they wanted to get a shot in every arm. And so people were less likely to get the vaccine if they knew monoclonal antibodies were an option. And yeah, and you spoke out against that as you should have. And now they're coming after you. So we will try to get your story out there as much as we can. And please keep us posted. And I hope everybody will put a GoFundMe that you can help donate to offset some of these horrible legal fees as well.
Yes, thank you. I really appreciate that. It's the legal fees. I mean, again, the lawyers are doing their jobs. I get it. Like they have to get paid. It's not, but they're exorbitant. And again, they've been very good about saying, well, you can pass when you can pass, but they want money before the trial. So like, I don't know what I'm going to do. I mean, just maybe sell my house. I don't know. I'm at a loss here. I don't know. It's the government is, it's like fighting the biggest Leviathan you could ever think of. And they have every resource imaginable and they bring it to bear and they just want to crush you like a bug under their foot. And they just will not let go. And it is absolutely horrific. And to talk about the monoclonals, I got a call one day out of the blue from a guy who said, look, it was like 9 o'clock at night. I was putting my kid to bed. And he said, I own a bunch of assisted living centers and our patients are dying right and left and I need somebody to help me. Can you help me? And I'm like, of course I can help you. What do you need? He said, oh my God. He said, I need monoclonal antibodies. And I said, okay, we'll be out there tomorrow. And he said, he was speechless. And I said, what's wrong? He said, you're the 27th person I've called to try to get help. And I said, I'll tell you what, here's the number to our scheduler. Call her because I can't help you. She's the one you want to call. Tell her I gave her your number. I gave you her number. And he called, and every single day he was bringing people in. In fact, one day his bus driver got sick, so he was driving the bus and he got sick. He called me and I said, get your butt in the chair. We're going to infuse you. And I'm still very, very good friends with this man. He's a wonderful human being. And he says to this day, he said, not only did you save my business, but he said, every single person, every single one without fail who got the monoclonal antibodies from you survived. And every single person who had COVID who did not passed away. He said, it is 100% and zero. Those are the numbers. And that was my experience throughout the entire pandemic. Um,
Exactly.
yeah. So I didn't mean to go off on a tangent, but I just thought that needed to be said.
No, we don't
Um,
talk about the monoclonal antibodies enough. It kind of got swept aside, but it was a huge frustration of mine as well. And so when they took them away, that's when I started using ivermectin because there was, I didn't have any other options. But yeah, they worked really well. But I am so sorry you're going through all this, and we'll keep tabs on your saga, and I hope everybody can help out. And if you can't donate, at least share the story so we can get this to the appropriate people in the government. Hopefully, we can get this dismissed.
yes, please. Thank you. Please, anybody who can help, anything, $5, $10, whatever you can donate, please. Like this is just it's astronomical, and you face such an uphill battle. And I just want to reemphasize that when the judge did what he did, took a ton of courage. I mean, judges never do this, apparently. I'm not a lawyer, but I've been told that this happens once every 100 years, maybe, that a judge takes away a jury verdict because he's
Mhm.
so sure that something was, that there's no evidence. I mean, this took a lot of courage. I mean, think about that. And he wrote 93 pages, a lot of extra work for the man. He could have just said, well, I would have, if I was on the jury, I would have voted to acquit him, but sorry, bad luck. But
Right.
instead, he took his job seriously, and he did the right thing, and I really applaud him for that. But a lot of judges would not have done that, so kudos to him.
Yeah. Yeah, I've never heard of that before. So that is amazing. Hopefully, the new judge will be as wise.
Yeah, so hopefully it doesn't come to that. But yes, yeah,
Yeah.
yeah.
All
But
right.
thank
Well,
you again. I really appreciate it, and this was great. So thank you, and thank you everybody for listening. And please share with your friends and share with people who think can help.
thank you. Thank you, Ron.
Thank you, Mary. Have a good night. Happy Christmas and happy Hanukkah, everybody.
Yeah. Thanks for joining us again. And this is our last show until the new year. So we will see you in 2026, and have a Merry Christmas and a Happy New Year.